What is type 1 diabetes? Type 1 diabetes or insulin dependent diabetes is usually seen in younger patients, but it may develop in any age. Type 1 diabetes is when the body attacks its own pancreas and destroys the insulin producing cells. If your body doesn't produce any insulin, your body will not be able to break down glucose, and as a result, your body will not get the energy that it needs.
Great information, Brittany. How's it managed, you may ask? By two forms. One is an injection method, and the other is an insulin pump. Insulin pump is the most common method, usually where the insulin pump on the side, you can conceal it with clothes, usually one on the hip, and it actually determines when you need your injections, and it's highly adjustable.
Balancing insulin levels may be hard at first because it tends to fluctuate depending on the diet and activity. Some factors that influence this would be food, stress, exercise, and emotions.
Some of the risk factors include hypoglycemia. If your body makes too much insulin and taken into the body, it burns too much glucose. Glucose is sugar, resulting in a dangerously drop in your blood sugar. This could be life threatening.
Signs and symptoms of hypoglycemia. Hypoglycemia has a sudden onset. The skin may be pale, cool, or clammy. A person may be disoriented, and in late stages, they may become unresponsive.
How to treat the first stages of hypoglycemia. We usually want to treat these with simple sugars, so like a fruit, hard candy, or juice box.
Another condition often seen in patients with diabetes is hyperglycemia. Hyperglycemia occurs if the insulin levels are too low in your body. Your body is being starved from the energy that it needs. What happens is the cells tend to try to turn fat into energy, which creates waste products in the bloodstream. This will make the patient feel ill or sick. This is also called diabetic ketoacidosis.
Great information, Brittany. Some of the signs and symptoms of hyperglycemia include gradual onset, so it onsets slowly, so it's not going to like hit you like right away, so you won't notice it. Flush, warm, or dry skin. Frequent urination, so you have to go to the restroom more than usual. So whatever your usual is, you'll have to go slightly more. Fruit or sweet odor on the breath. So not unless you have like breath mints or gum or anything like that. So just plain in your mouth, someone tells you, oh man, your breath smells great. It's warning signs, things to look out for. Irregular breathing, it's a big one. So whatever breathing is for you, if you're not doing physical activity, or if you are doing physical activity, which we're explaining this for, then you might want to know exactly how you kind of breathe, have a good idea. So if you're hyperventilating or whatnot. Drowsiness or disorientation. So if you don't know who you are or where you are, those are the kind of things that are the signs and symptoms of hypoglycemia. Nausea and feeling ill. So any sick feeling, sick to your stomach or whatnot. Nausea, feel like you want to vomit or whatnot. So any of those are the signs and symptoms of hyperglycemia. The late stages are unresponsiveness. So if you go to someone and they won't wake up and they're unconscious, that could be one of the signs of hyperglycemia. Back to you, Brittany. Brittany, one of the most popular questions that we get in this field is, does diabetes, especially type 1, stop you from participating in sports?
The answer to that question is yes and no.
Well, that's a confusing answer. What do you mean by that?
What I mean is, athletes that have diabetes that participate in sports must check their blood glucose on a regular basis to prevent diabetic episodes. This means they need to have a proper balance between exercise and diet.
Well, thank you for that answer. It's much more well defined now. We could see how many people have been guided the wrong direction due to misinformation or not having the correct information. So one of the other questions is, when do you check your glucose level? In experienced athletes, well, that's when these people usually check. It's 30 minutes prior to the activity and then right before. Being that you're 10 years old, we do want you to continue those standards to get used to it, but we want you to check your 30 minutes before, which is typical. During like right before the activity, like halftime. You want to check around that time too, or any time that you're like on the bench. So if you're playing basketball at the end of the first quarter, at the end of the second quarter, at least for the first couple of games, so you can get a good feel on how you feel and what the warning signs are, and then also let your athletic trainers know on staff, or at least your coach or someone sitting next to you know that you did check and you were regular or in acceptable levels. And of course, you want to check right after the game. So in case you needed to treat yourself with simple sugars or an insulin injection or whatnot, you have all those items ready and available for you. Brittany? Along with the other guidelines I just mentioned. So, Brittany, what happens if your blood glucose level is below 100?
If your blood glucose is below 100 prior to activity, I would suggest you eat a simple carb snack. This would include juice, a hard candy, chocolate, just so it goes into your body fast.
So it's absorbed quickly then?
Yes.
All right. Awesome. Good advice there. So what happens if the blood glucose level, I know it's weird to say, glucose level is between 1 and 200?
If your blood glucose level is between 100 and 200, you are okay to participate in sports.
Okay, so no simple sugars needed, nothing.
Nope.
You're just good to go. So
You're
that's
good
like
to
really
go.
where we want to be at then, at that
Exactly.
point. Okay, so let's talk about what we don't want to be. What happens if our blood glucose level is higher than 250?
If you check your blood glucose and it's higher than 250, you must be taken out of the game or whatever practice you're participating in immediately, and you must test your urine for ketones in the urine. You could test your urine by using test strips that should be provided by your coach or your athletic trainer. If in fact you do have ketones in your urine, you must be disqualified from participation in sports until your blood glucose goes down to a normal, healthy level.
Now, this is one of the points that we need to drive home, okay? Everyone wants to participate in their sports. Everyone wants to do the best that they can. They have those feelings that they don't want to let the team down or anything like that. So this is where it is up to the parents to instill, along with videos like this, to instill into the children that their health is most important. The game will always be played. Their life will go on, this, that, and the other. Their health is most important. So not to feel too hard on themselves if they have to be taken out of the game, because we need to make sure that they are alive the next day and no health consequences are taken against them. So the diet is one of the other key components of managing your diabetes. So speaking on diet, we want to highly emphasize that carbs come in two different sections, simple and complex. So we already discussed some of the simple carbs or sugars that you can put into your body, such as fruit, juice, hard candy, and some of the complex carbs that you can put in. Well, complex means it takes your body a little bit longer to put them into your blood system or your bloodstream, to break them down, so to say. So whole grain, peanut butter, cheese, and crackers, things of those sorts.
Another key component to keep in the back of your mind is that if you're participating in prolonged activity, you should be ingesting simple sugars every 30 to 60 minutes, which is 15 to 30 grams of carbs.
So with this information, we highly advise that you do see your physician and come up with a good diet and routine, something that you can maintain so you can keep your health at an optimal level. Thank you.
It is also important to educate not only yourself, but your coach, your athletic trainer, and your teammates. Well, Dre, why do you think this is important?
I think it's important for a different multitude of reasons. Most importantly, the athletic trainers on staff like to carry a list of items around, which Brittany will go over in a minute. But they have to know how many people they have on the team that they need to cover that are actually diabetic. So if you're only going to have one juice box for one person, there's probably not going to be enough. So you're going to need more than that, more supplies. You also have to have more frequency when you check on these people, these individuals. So even if there is some ankle sprains or whatnot that they have to check on throughout the time, they are keeping a watchful eye. And as athletic trainers, love to multitask. So we have to keep a watchful eye on individuals that are medium to high risk. And also, if the player needs anything, then we know that privacy is most important. So if the person comes to you and says they need to talk to you or they're not feeling well, that's a key sign in our head to know that that may be one of those key factors. And then in case any other new treatments come out that athletic trainers like to read about and keep up to date on, then we know we can use those things, and we know that someone on the team can actually benefit from those methods of help. Speaking of life-saving measures and whatnot, Brittany, can you tell us what is the typical complement, or what will athletic trainers need to pack?
An emergency equipment checklist should include a diabetes care plan, a medical tag, glucometer, test strips, sugary foods, sugary fluids, a glucagon injection kit, insulin syringes, insulin, alcohol swabs, a urine testing supply, ketone testing supplies, sharps containers, spare batteries, pump tubes, and a nickel. Nickel to open pump. I don't know what that is. I'm not saying that. But we could cut it.
No. It's the pump. That's a good learning tip, guys. You have to actually know the equipment when you do that. So you have to know that the nickel actually opens up the pump itself. Also, some of these things are that you need to keep on the site. Some of these things are responsibility of the parents to bring with them. So we always have to make sure that the parents, know how to read the equipment. So the glucometer, you have to know how to read the strips. You know what strips are for what particular glucometer. We learned that in class. Thank you, Professor Winkelspeck, for that. And you actually have to know what it means. So you have to review our video here to tell you what it means between glucose meters of 100 to 200, and above 250. So not only for participation in sports, but for everyday life as well. You also have to know the warning signs and what not to look for, which we already covered. So for us explaining this to you, being a 10-year-old, to try and play sports, we say yes and no. You just have to make sure you have a healthy diet. Make sure that you know what signs to look for. Being as the parent, you have to make sure that the proper people in proper place know exactly what's going on with the child. And with the child, son, you just need to know that if you can't do something, it's okay as long as you try and try very hard. And we also made a little handout for you guys. So, with that said, here's our handout. See if we can get this to be read here.
So this is a diagram of what is happening in your body when you digest food. So basically, I'm over here.
Here we go.
So basically, you're eating food, and your metabolic processes in the liver turn your food into glucose. Your glucose is then transported to your blood, which turns into blood glucose.
And with the blood glucose, it gets turned into simple sugars to go ahead and get broken down, rather, to go into your cell to make energy. But that process requires insulin. That's where the pancreas comes in. So the pancreas does not recognize that the blood glucose level is too high or too small, and there will be no transmission of insulin, and then the cell will not get the nutrients it needs in order to process the energy that you need. In turn, starving the cell or overloading the cell. Either one can happen at that cost, or at that